breathing exercises. These are going to be a crucial and integral part of your pregnancy and postpartum journey. What happens during pregnancy is what? The abdominals start to separate, right? By probably the third trimester, 90 to 100% of women will have some degree of abdominal separation to accommodate a growing baby. It's a completely normal part of pregnancy. So what happens is breathing gets harder, right? It starts to become a little bit more labored. There's less room in the belly because there's a baby there and fluid and all of these things. So these breathing exercises are going to be key when it comes to still working your core during your pregnancy and also repairing and healing it postpartum. So you're going to see three different variations of breath work. You're going to see a quadruped variation, so hands and knees. You're going to see a seated variation, so it could be on a stability ball, which I recommend, or it could be standing, or you could be supine on your back. So I think I said three different variations, but 4 different variations of breathing. When you breathe, I want you to keep in mind, I want you to pretend like there's a corset around your midsection. And when you're breathing, when you inhale, you fill 360 degrees around. So not just belly, but also ribs, side ribs, and back ribs. Okay, so that's why the 4 different variations of breath work are so important, because you're gonna feel it differently in each one. My favorite variation is quadruped. Because I feel like you really have to focus on filling 360 degrees around with your inhale, okay? Now, I want you to keep in mind, this breath is also good to activate your pelvic floor, okay? So when you're inhaling, you let everything go. You let the belly go, you let the pelvic floor relax, and then as you exhale, kind of contract everything, do a little pelvic floor contraction, so like you're trying to hold your pee, or like a Kegel, or like you're zipping up your clit. I know, weird cue, but it works, okay? So when you inhale, let everything go, and then when you exhale, draw everything up and in. You'll see demonstrations in the following videos. In this quadruped position, your hands are going to be directly under your shoulders and knees directly under your hips. As you take a big inhale, you'll notice how my belly gets distended and fills with air. And then as you exhale, draw that belly in towards the spine, and you'll do a little pelvic engagement as well, pulling almost like a Kegel, like you're trying to stop the flow of urine. So inhale, belly fills, ribs fill, exhale, draw in. Laying on your back in a supine position, you can either keep the knees bent and feet flat on the floor, or you can extend the legs straight if that's comfortable. You're going to place your hands on the side of your rib cage, and as you inhale, you'll feel the belly and ribs fill with air, and then as you exhale, feel it draw in. Do a little pelvic engagement like a Kegel as you do that exhale. Continue this motion. Inhale, filling up the diaphragm, the rib cage, 360 with air. And then as you exhale, feel it compress and draw in and engage. While seated, you can sit on either a stability ball or something stable like a chair or a bench. Keep your hands on the side of your rib cage. As you inhale, again, you'll feel that breath fill your belly and ribs 360 degrees, so all the way around your midsection like a corset. And then as you exhale, feel the belly draw in and up towards your sternum and spine. And then do that pelvic lift as well as you exhale, meaning that slight little Kegel. Inhale, belly fills. Exhale, belly collapses. For standing breath work, again, place both hands on your belly or your side ribs. As you inhale, feel the belly and ribs fill with air. As you exhale, feel it draw in and up towards the sternum and do that little pelvic lift, that Kegel as you exhale. Inhale, belly fills. Exhale, belly falls. Then you can see a demonstration as I lift up my shirt. See how my belly lifts in and kind of up towards the sternum.